What if one simple leaf could help support healthy blood sugar levels and at the same time promote better artery and heart health? It may sound surprising, but that's exactly why guava leaves are gaining attention in natural health discussions. While most people are familiar with the sweet tropical fruit, fewer realize that the leaves of the guava plant have been used for centuries in traditional medicine. Today, modern research is beginning to explore and support some of these traditional claims. Guava leaves contain powerful plant compounds, including antioxidants, flavonoids, and anti-inflammatory agents. Antioxidants are important because they help protect the body from oxidative stress, a condition caused by an imbalance between free radicals and antioxidants. Oxidative stress is linked to chronic conditions such as diabetes, heart disease, and inflammation. By helping neutralize free radicals, guava leaves may provide protective benefits at the cellular level. One of the most talked about benefits of guava leaves is their potential role in supporting healthy blood sugar levels. Some studies suggest that compounds in guava leaves may slow down the breakdown and absorption of carbohydrates in the digestive system. When carbohydrates are absorbed more slowly, blood sugar levels rise more gradually instead of spiking sharply after meals. This can be particularly helpful for individuals who are managing type 2 diabetes or prediabetes. Additionally, certain research indicates that guava leaf extract may help improve insulin sensitivity, meaning the body can use insulin more effectively to regulate glucose levels. Beyond blood sugar control, guava leaves may also support cardiovascular health. Heart disease remains one of the leading causes of death in the United States, and maintaining healthy arteries is a major part of prevention. Some research suggests that guava leaves may help lower LDL cholesterol, often referred to as bad cholesterol. High LDL levels can contribute to plaque buildup in the arteries, which may restrict blood flow and increase the risk of heart attack or stroke. By potentially reducing LDL levels and inflammation, guava leaves may help support cleaner, more flexible arteries and improve circulation. Another benefit lies in their anti-inflammatory properties. Chronic inflammation plays a role in both diabetes and heart disease. The natural compounds found in guava leaves may help reduce inflammatory markers in the body, offering additional support for long-term metabolic and cardiovascular health. Guava leaves are commonly consumed as tea. Typically, fresh or dried leaves are boiled in water for about 10 minutes, strained, and enjoyed once daily. However, it's important to remember that while guava leaves may offer supportive benefits, they are not a replacement for medical treatment. Anyone taking medication for diabetes, blood pressure, or heart conditions should consult a healthcare professional before adding herbal remedies to their routine. In summary, guava leaves represent a promising natural option that may help support balanced blood sugar and healthy arteries. When combined with a balanced diet, regular exercise, and professional medical guidance, they can be part of a holistic approach to better health. Guava leaves have gained attention for their potential role in supporting healthy blood sugar levels, especially for individuals concerned about prediabetes or type 2 diabetes. These leaves contain a variety of beneficial plant compounds, particularly antioxidants and flavonoids. Antioxidants help protect the body from oxidative stress, which occurs when there is an imbalance between harmful free radicals and the body's ability to neutralize them. Oxidative stress is closely linked to chronic conditions like diabetes because it can damage cells, including those involved in insulin production and glucose regulation. By reducing oxidative stress, guava leaves may help create a healthier internal environment for blood sugar control. One of the key ways guava leaves may support blood sugar balance is by influencing how carbohydrates are processed in the body. When we eat carbohydrate-rich foods, they are broken down into glucose, which enters the bloodstream. This process can sometimes cause rapid spikes in blood sugar, especially after meals. Certain compounds found in guava leaves are believed to help slow down enzymes responsible for breaking down complex carbohydrates into simple sugars. As a result, glucose is released into the bloodstream more gradually. This slower absorption can help prevent sharp increases in blood sugar levels after eating, leading to more stable glucose readings throughout the day. Another important factor in blood sugar management is insulin sensitivity. Insulin is the hormone responsible for helping glucose move from the bloodstream into the body's cells, where it is used for energy. When someone has low insulin sensitivity, also known as insulin resistance, the body's cells do not respond effectively to insulin. This causes glucose to remain in the bloodstream, leading to elevated blood sugar levels. Some research suggests that compounds in guava leaves may help improve insulin sensitivity, allowing the body to use insulin more efficiently. Improved insulin function can contribute to better long-term glucose control. In addition, guava leaves may have mild anti-inflammatory effects, which can also play a role in metabolic health. Chronic low-grade inflammation is often present in individuals with insulin resistance and type 2 diabetes. By helping reduce inflammation, guava leaves may provide additional supportive benefits for overall glucose regulation. Guava leaves are most commonly consumed as a tea. Fresh or dried leaves are boiled in water for about 10 minutes, then strained and consumed once daily. While some studies show promising results, it's important to understand that guava leaves are not a cure for diabetes. They should be viewed as a supportive, complementary approach rather than a replacement for prescribed medication, insulin therapy, or professional medical care. Anyone currently managing diabetes or taking blood sugar-lowering medications should consult a healthcare provider before adding guava leaf tea or supplements to their routine. When combined with a balanced diet, regular exercise, and medical supervision, guava leaves may offer an additional natural way to support healthy blood sugar levels. Guava leaves are increasingly being discussed for their potential benefits in supporting artery and overall heart health. Cardiovascular disease remains one of the leading health concerns in the United States, and maintaining healthy blood vessels is a major part of prevention. The condition of your arteries directly affects how well blood flows throughout your body. When arteries become stiff, inflamed, or clogged with plaque, the risk of heart attack, stroke, and high blood pressure increases. Natural compounds found in guava leaves may offer supportive benefits that help protect these vital blood vessels. One of the key areas where guava leaves may help is in managing LDL cholesterol, often referred to as bad cholesterol. LDL cholesterol can accumulate along the walls of arteries over time, forming fatty deposits known as plaque. As plaque builds up, arteries become narrower and less flexible. This condition, known as atherosclerosis, restricts blood flow and forces the heart to work harder to pump blood. Some research suggests that the plant compounds in guava leaves, particularly flavonoids and antioxidants, may help reduce LDL cholesterol levels. Lower LDL levels mean less material available to form plaque, which may support cleaner, more open arteries. In addition to potentially lowering LDL cholesterol, guava leaves may also help reduce overall inflammation in the body. Chronic inflammation is a major contributor to cardiovascular disease. When blood vessels are inflamed, their inner lining can become damaged, making it easier for cholesterol and other substances to stick to the artery walls. Over time, this can accelerate plaque formation. Guava leaves contain natural anti-inflammatory compounds that may help calm this internal inflammation. By supporting healthier blood vessel linings, they may reduce the likelihood of plaque buildup progressing quickly. Another important factor in heart health is circulation. Healthy arteries are flexible and able to expand and contract as blood moves through them. This flexibility helps regulate blood pressure and ensures that oxygen-rich blood reaches organs and tissues efficiently. Some evidence suggests that guava leaves may help improve endothelial function, which refers to how well the inner lining of blood vessels performs. When endothelial function is strong, blood flows more smoothly, and the risk of clot formation may decrease. Better circulation supports not only heart health, but also brain function and overall energy levels. It is also worth noting that oxidative stress plays a significant role in the development of heart disease. Free radicals can damage blood vessels and oxidize LDL cholesterol, making it more likely to stick to artery walls. The antioxidants found in guava leaves may help neutralize these harmful molecules, providing additional protection for the cardiovascular system. While these potential benefits are promising, guava leaves should be viewed as a supportive addition rather than a replacement for medical treatment. A heart-healthy lifestyle, including balanced nutrition, regular physical activity, stress management, and routine medical checkups, remains essential. Individuals taking cholesterol or blood pressure medications should consult their healthcare provider before adding herbal remedies. When combined with healthy habits, guava leaves may offer natural support for maintaining strong arteries and overall cardiovascular wellness. Guava leaves are most commonly used in the form of tea, and preparing them properly is important to get the potential benefits. The process is simple, affordable, and can easily be added to a daily wellness routine. However, consistency and safety are key when using any natural remedy. To begin, you will need either fresh guava leaves or dried guava leaves. If you are using fresh leaves, take about 5 to 7 medium-sized leaves. Make sure they are clean and free from pesticides or chemicals. Rinse them thoroughly under running water to remove any dirt or residue. If fresh leaves are not available, you can use approximately 1 tablespoon of dried guava leaves instead. Dried leaves are often available in herbal stores or online and can be a convenient alternative. Next, bring 1 to 2 cups of water to a boil in a small pot. Once the water starts boiling, add the fresh or dried leaves. Reduce the heat slightly and allow the leaves to simmer for about 10 minutes. This simmering process helps extract the beneficial plant compounds, including antioxidants and flavonoids, from the leaves into the water. You may notice the water changing color to a light brown or greenish shade, which indicates that the compounds are being released. After about 10 minutes, turn off the heat and allow the tea to cool slightly, then strain the liquid into a cup to remove the leaves. The tea is now ready to drink. Many people prefer to consume guava leaf tea in the morning, especially on an empty stomach, as this may help with better absorption. However, it can also be taken after meals if the goal is to support blood sugar control following carbohydrate intake. For best results, consistency is important. Guava leaf tea is not a quick fix. It may take several weeks of regular use to notice supportive benefits. Drinking 1 cup daily for 4 to 6 weeks is a common approach in traditional use. Keeping a steady routine allows the body time to respond to the natural compounds found in the leaves. It is important to remember that guava leaf tea should be viewed as a supportive addition to a healthy lifestyle, not a replacement for medical treatment. Individuals who are taking medications for diabetes, blood pressure, cholesterol, or heart conditions should speak with their healthcare provider before adding guava leaf tea to their routine. Because the tea may influence blood sugar levels, combining it with medication without supervision could potentially cause blood sugar to drop too low. Pregnant or breastfeeding women should also consult a healthcare professional before use, as there is limited research on safety in these situations. Additionally, if you experience any unusual symptoms such as stomach discomfort, dizziness, or allergic reactions, discontinue use and seek medical advice. When used responsibly and consistently, guava leaf tea can be a simple, natural addition to a balanced diet, regular exercise, and proper medical care. When it comes to improving your health, it's easy to look for one powerful solution that fixes everything. But the truth is, lasting health rarely comes from a single pill, herb, or shortcut. Natural remedies, including guava leaves, can play a supportive role, but they work best as part of a bigger, balanced approach. Guava leaves have gained attention because of their potential to support healthy blood sugar levels and promote better artery health. They contain antioxidants, flavonoids, and anti-inflammatory compounds that may help reduce oxidative stress in the body. Since oxidative stress and chronic inflammation are linked to both diabetes and heart disease, reducing these factors can contribute to overall wellness. Some research suggests that guava leaves may help slow carbohydrate absorption, improve insulin sensitivity, and reduce LDL bad cholesterol levels. These effects, if consistent, can support more stable blood sugar and healthier blood vessels over time. However, it's important to understand what support really means. Natural remedies are not magic cures. They do not replace prescribed medications, insulin therapy, cholesterol-lowering drugs, or professional medical care. Instead, they may enhance your overall health strategy when used responsibly. Think of guava leaf tea as one tool in a much larger toolbox. For people managing blood sugar, stable glucose levels depend heavily on daily habits. A balanced diet that includes fiber-rich vegetables, lean proteins, healthy fats, and controlled carbohydrate portions plays a major role. Regular physical activity improves insulin sensitivity and helps the body use glucose more effectively. Even simple habits like walking after meals can significantly impact blood sugar control. When these healthy behaviors are in place, adding a natural option like guava leaf tea may offer additional support. The same principle applies to artery and heart health. Lowering cholesterol and protecting blood vessels involves more than one factor. Reducing processed foods, limiting added sugars, avoiding smoking, managing stress, and staying physically active all contribute to better cardiovascular outcomes. Regular medical checkups and blood tests help track progress and catch potential issues early. Guava leaves may help support healthier cholesterol levels and reduce inflammation, but they cannot undo the effects of an unhealthy lifestyle on their own. Another important takeaway is safety. Just because something is natural does not automatically mean it is safe for everyone. People taking medications for diabetes, blood pressure, or heart disease should always speak with their healthcare provider before adding herbal remedies. Natural compounds can sometimes interact with medications or amplify their effects. Responsible use is key. In the end, the most powerful health strategy is consistency. Small, smart choices made daily create long-term results. Guava leaves may offer promising benefits for blood sugar balance and artery health, but they work best when combined with nutritious eating, regular exercise, proper sleep, stress management, and professional medical guidance. Health is not about quick fixes, it's about building sustainable habits. When natural support and healthy living come together, that's where real, lasting progress begins.